So for the agenda today, I'm going to give a 5-minute introduction and an overview to our network and tell you a bit more about our Research and Evaluation Forum and our draft plan for the network for 2024. And then I'm going to hand it over to our guest speaker for today's event, Dr. Megan Borlase, who will give the presentation. There will be some time for some Q&A after Megan's presentation, and I'll also highlight some upcoming opportunities that you may like to get involved with. Just a couple of housekeeping things to note. By default, you will be on mute, but your camera will be turned on. So this session will be recorded. So if you don't want your face shown in the recording, please feel free to turn your camera off. If during Q&A you would like to ask a question, you can write the question in the chat function. And the other option is you can put your hand up using your raise your hand emoji and then take yourself off mute to ask the question. Please introduce yourself and your organisation you work for so it's easier for us to, and for Megan to tailor her responses accordingly. So if we run out of time with the Q&A, we can follow up with you individually after the session. Just pop your question in the chat pane. So I would like to begin by acknowledging the traditional owners and custodians of this land, the oldest continuing cultures, languages and knowledge holders in human history. I'd like to acknowledge and pay my respects to all First Nations colleagues and friends joining us online today. I'd also like to acknowledge the Yagara and Turrbal peoples of the lands on which I work and live here in Meanjin in Brisbane. So for those online, please feel free to join us in acknowledging country where you are today through the chat function as well. My name is Amy Dellett and I'm the Data and Reporting Analyst in the Research and Policy team at QCOS, and I coordinate our Research and Evaluation Network webinars and our online forum. So in our post-event email last month, we shared the current terms of reference for the network, and we'd like to continue to invite you to review these terms of references. And if you'd like to get in touch or provide any feedback on the document, please email our team. Email address is research@qcos.org.au. So in terms of membership, this network is open to QCOS members and non-members. So if you work in the community services sector and you find our webinars valuable, we really encourage you to consider membership, which can be either individual membership or membership through your organisation. And joining QCOS as a member provides access to lots of great networks and opportunities, and it's a really great way to support the work that we do. So if you're not sure whether your organisation is a member, just reach out to us and we can chat further. So in terms of the Research and Evaluation Network, it's an opportunity for collaboration and knowledge sharing in data analysis, research and evaluation for the community services sector in Queensland. You can learn more about focus topics, for example, data visualization, storytelling and communicating impact, systems evaluation and qualitative research. It's also really an opportunity to keep on top of sector issues and feel less isolated in your role, and an opportunity to network and develop partnerships. So yeah, like I said, everyone is welcome. In terms of, you can also access resources through our Research and Evaluation Network webinar recordings and resources on our Community Door Research and Evaluation Resources Hub page. And I'll just share the links with you in the chat pane now. Sorry, I see that that's got awful yellow highlighter, and I'll change that for the next webinar. I'm sorry. It's just a flag for me to share resources as I go. So a friendly reminder, we also have a research and evaluation forum that sits within the Microsoft Teams platform. And I've shared instructions on how you can join the forum in the chat pane. So the idea behind the forum is that we're providing a space and an opportunity for our network members to collaborate and exchange ideas and access professional development opportunities. So in terms of communication, I do also email the network about once a month about upcoming network events. So keep an eye out on your inbox for those emails. It's now my absolute pleasure to introduce our guest speaker for today's event, Dr. Megan Borlase, co-CEO at Logic Institute. Megan has postgraduate degrees in psychology and applied behaviour analysis. She has spent her adult life working in disability support services in England, New Zealand, USA and Australia. She completed her doctorate in ABA in 2015 at Caldwell University, New Jersey, USA, and has been a board certified behaviour analyst since 2013. She's an experienced presenter and has worked as a supervisor and trainer for over 10 years. And Megan has completed the Foundations of Directorship from the Australian Institute of Company Directors and works as part of an executive team. Megan has presented her research at international and domestic conferences and has research published in the Journal of Applied Behaviour Analysis. She also oversees research, development, learning, delivery, and consultancy at Logic Institute, where their mission is intentional influence. So you may all remember Megan from our network webinar last year, which she presented on the role of human research ethics committees for the sector. And it's really lovely to reconnect with you, Megan. It's always great to hear your ideas and learn from you. And I think it's been about a year now since our last webinar together, so very timely. So just like to welcome you back today, and I'll stop sharing my screen and I'll hand it over to you.
Yeah, yeah. I think if it hadn't been for the leap year, it would have been a year exactly.
Too funny.
Okay, so I will just share my screen and get this up. All right. So thank you everyone for coming along today. I have to leave exactly at, I live in Sydney, so I have to think what the time is over there, at 11. So I will make this short and sweet, but hopefully informative and fun. And you will be more like, both myself and Amy will share my contact information. So if anyone wants to reach out and have a chat about anything, you're absolutely welcome to after the event. I'm more than happy to talk about this stuff at any time, really. So we're deciding to not work. There we go. Basically, what I'm going to cover is just a quick introduction into Logic, why we went down the path of an evaluation framework, and then I'm going to cover off the objectives that were discussed in the about this webinar. So impact versus outcome, some strategies for measuring impact, why you should be disseminating your evaluation activities, what quality assurance or evaluation is under the NHMRC guidelines, and then talking a little bit about an evaluation framework that can be used to address dissemination issues. I just noticed that I have frame instead of framework, and funnily enough, this has been through like 3 or 4 sets of eyes and nobody noticed.
I noticed, but I thought it was intentional.
Okay, nobody said anything. All right, so basically Logic Institute, we work across New South Wales and Queensland, but we have staff in Victoria and South Australia as well. We provide research and evaluation.
Darling. Sorry.
Behavior support, direct support, learning delivery, consultancy, and we do human research or evaluation ethics review. So we are, I talked about it last year, but we are this close to putting in an application to become a registered human research ethics committee. So there will be some information that goes out about that for anyone who's interested in joining us as a member. And I'll talk a little bit about our ethics committee a little bit later in this conversation. So why we wanted to go and have a look at options for evaluation. Well, we really rely on research to guide our practice, and it can be really thin on the ground, particularly like in our behavior support team, for example. Most of the behavior analytic research exists with kids with autism. It's almost exclusively based in America. Like there's not a lot of options outside of that. So we wanted to build that research base, and we couldn't find what we needed in order to do a lot of the work we're doing. We had to kind of piece together different bits and pieces. And then once we'd done all these really cool things, we had nowhere to take it because we didn't know how to actually get it published. So we started looking into what options we had. So what did we do? Well, we spoke to the National Health and Medical Research Council. Like I said, we've established an ethics committee. We're just finalizing the process of becoming an actual registered human research ethics committee, and we're refining our evaluation framework. So the idea being that we should be able to now start publishing our case studies and things that we're doing, so it gets out into the broader public, and hopefully when other people are looking at doing stuff similar to what we're doing, they can actually find the evidence base behind it because we've already put it out there. And the idea behind doing this webinar and some of the other work we're doing is to make sure that other people in the sector can have the same opportunities without having to go through the same steps we had to. So the first thing we're going to talk about is impact versus outcome. And this is something that was hugely important for our previous CEO. It's something that matters a lot to us as well. And it's just this idea that there's more to what we do than just the direct outcomes that we see. So when we're talking about outcomes, we're talking about the thing that you're targeting to determine the success of your program or service on an individual level. So if you're doing a behavior change program, the outcome is that the behavior that you're targeting, the behavior that's causing issues for the person, for the family, for the community, is decreasing. The impact of that could be the positivity of their social connections that they have, the time that they're now able to spend at work or in the community or at school as a result of having lower behaviors. So it's that sort of difference. You're really just targeting the change in behavior, but the impact that you could be seeing is much broader. Outcomes can be both subjective or objective. And some examples are job satisfaction, change in behavior of concern, change of medication dosage, index of happiness, accuracy of data collection. It's very specific to that particular thing that you're targeting. Impact is the broader consequences of the service or program that you're using. So you're not just looking at the individual, you're looking at the family, the community, the people around that individual, the way that that person is now able to interact with their community and their environment. It could be long term. So it may be that the impact that you're having is that the change that you've helped instigate lasts for a very long time. It doesn't go away as soon as your service or program stops, it keeps going. It could be that it generalizes. So you've worked on this particular change, and I'm going to use behavior change because that's sort of my background, but you've worked on this behavior change at school, and they're now engaging in the same strategies to manage their own behavior at home and in the community. And you're seeing this generalization across different settings or with different people and things like that. So some examples of impact measures would be things like the family socioeconomic status. If you're having less behaviors, you may require less support. Less support might mean that the parents don't need to be home as much to take care of you, and they can actually go out and get jobs or have part-time jobs, and that improves the family's economy. Community engagement, you might be able to now more actively engage with your community, take part in different activities and things that you couldn't do before because your behavior was getting in the way. It could even be as simple as the family is now getting to spend more time as a family and less time focused on whatever behaviors are going on in that situation. Or it could be that the client successfully graduates high school or manages to get a job, which before they weren't able to do. So the reason that measuring impact is so important is we want to know what are the broad reaching results of what we do, not just the immediate, how is this impact, like how is this changing what we're measuring, but looking at a more broad perspective. That helps not only to see that what you're doing is extremely effective, but it also tells other people how effective this is. So if we want, say, policymakers or funding organizations like the NDIS to pick up on a particular style of service or program, by showing that that has a impact beyond just that immediate behavior change for the individual that you're working with, they're far more likely to take on something like that. So if that has an impact on reducing the NDIS funding that that person needs long term, and therefore reducing the requirements for the tax dollars that need to go into that, helping that one person, and therefore likely would reduce the tax dollars required to help multiple people who were going through the same service and program, they'd be more inclined to pick up that than something that doesn't have that same impact. If you can show the impact in what you're doing, then it makes it a lot easier for other people to pick up that instead of needing to do it themselves. So some ways that you could measure impact is things like collecting broader demographic information on the person you're working with the family and other people in their residence. So it could be that, you've got someone who is flatting and they live with other residents in the same household who aren't family, and how they act could impact the relationship they have with their roommates. And if that's helping with everyone in that house, then that's having a good impact on the household as a whole, not just on that one person. You can be looking at quality of life indicators for the client, family members, other residents, and or staff. So is what you're doing also creating a better life for your staff members who are working with that person? Do the staff now feel more happy and comfortable working with the individual? Things like that. You can look at the social economics impact of your service or program. So looking at things like support plans over time. Do their support needs change as a result of their service? Does this have an impact on the amount of money that they need to get the supports that they require? Have they gone from a 2-to-1 to now a 1-on-1? Do they still need 24/7 support? Like looking at things like that. And another example is reviewing changes in things like restrictive practices or medication used over time. Is there a change occurring here that we can see? Like, is this working well to reduce restrictive practices, which is something that's really a big focus of late, is that rejection or complete removal of restrictive practices in Australia. So looking at all of these things can actually help further strengthen and support what you're doing and why other people, aside from yourself, well, why you guys should be continuing to do it, but also why other people should be picking it up. And in a broader sense, why policymakers should potentially be legislating that that's how it goes, or funding organizations should be putting money into it. So why evaluate and disseminate? So the first thing is that this shows people more broadly what you're doing. Generally, what's happening at the moment, I know in our organization, we'll do evaluations, but the evaluation doesn't go any further than our staff and our board. It might go to our clients and our customers, but that's kind of as broad as it goes. We haven't had a process to be able to take this to other service providers to see what we're doing, to universities to see if they want to potentially do some research in that space, to policymakers, to anyone else. So it's a way to get that out there and to get recognition for your innovation and your successes, and even just to discuss why something didn't necessarily work. So there's a tendency, particularly in journal publications, that things that didn't work don't really get published. It's still important to get things out there that didn't work. So we recently did some stuff in disaster preparedness and looked at how well our staff knew what to do in the event of a disaster. So we have a lot of staff in Lismore and things who were part of that flooding situation 2 years ago. And they managed fine. Everyone was happy. Like, well, not happy. They were stuck in a house for a few days without actually being able to leave the job, but everyone was safe, which is the main thing. But that prompted us to go, okay, well, how well does everyone know what they should be doing? How well are we sticking to the legislation around like disaster preparedness for disability support housing? And we're not doing fantastic. So we looked at, well, how's everyone else doing? And to be honest, they're not doing fantastic either. So now that's prompted us to look at a broader survey to see where everyone's at, and then look at, okay, how can we establish a program and a tool that will help people do this better, including us. So sometimes it's important to just go, shit, this isn't working. So what are we going to do? And taking that out to everyone else to get ideas, to put it out there. Maybe you don't have the answer, but someone else might. But if they don't know that the problem exists, they can't find a solution. You get your name in lights. You get your name on publications and things. It can look good on a survey, SUV, sorry. And if you're ever wanting to move into a different area of the sector, maybe you want to do some academic work or you want to do some research and things, having your name on publications can be useful in terms of getting into some of those different sectors of work. It can improve the quality of life for service users, for their support networks, and for your own staff. You lead the way. So there's probably a lot of stuff out there that we're all doing that's fairly similar, but isn't actually, it's kind of, everyone's had to sort of come up with the idea on their own because there's not really a lot of sharing that's able to be done or has been able to be done, or that we've been able to find ourselves. I mean, it could all be out there and I just haven't seen it. But by getting your evaluation published and disseminated, it means that everyone doesn't have to come up with the same innovations. They can build on those innovations, they can take them further, but starts paving the way for everyone else to kind of go forward and do this. So it grows the evidence base. So all of that research and everything that people look at to try and figure out what to do next, it starts to grow that. It's good just for a quality check for yourselves. So the reason that we like most organizations do evaluation right now is it's just to check the quality. Like, what are we doing? Are we doing it right? Are we doing it well? Yes, no, what do we need to change? How do we keep being the best service we can be? Sorry, my cat just got the zoomies. It then takes that information and shares it outside of just your own quality checks. And it also tells people, you're a quality service and there's evidence as to why you're a quality service. You're not just saying I'm great, you're showing it with data. And again, it influences policymakers. If you get it out there in official channels, then policymakers are more likely to view it as legitimate and more likely to consider it for when they're looking at policy changes. Okay, so the National Health Medical Research Council is the body that it's part of the group that sets the national standards for research, and part of that is setting a national standard for what quality assurance or evaluation should look like. Basically, all human research ethics committees are registered under these guys. They are the ones who provide the oversight to make sure that those committees are doing the right thing, and their role is to basically ensure that research is being done in an ethical manner across the entire country. When we're talking about quality assurance or evaluation, under that, you're talking about evaluating the participants' existing environment to understand the effects. So your risks are exactly the same risk that they would have from the service or program that they're receiving. So you're not introducing any new risks. There's no research being done. It's simply taking the work that you're doing with them anyway and looking at, is this working, and then taking those data and using them. For this, you can cover the consent in the evaluation for evaluation in their service consent form. So if you've ever gone to the doctor and actually read their consents, that always includes something about being able to potentially publish your data in a de-identified manner, blah blah blah. But it's in that agreement, so they don't have to come to you for specific approvals and consent after the fact. So in evaluation, as long as you have that consent prior to doing the stuff, prior to the service that you're evaluating, you're covered in terms of consent. Ethics approval is sought after the evaluation is complete. So this was the challenge that we were having when we were talking to people about wanting to publish what we were doing. They kept telling us, no, you can't, because you need to go and get ethics approval before you do it. Now, the kind of people that we work with are resulting in hundreds of hospital visits a year. They might be engaging in suicidal ideation or suicidal attempts. There's a lot of very extreme behavior that's resulting in hospitalization for themselves, for staff, for family members. There's no time to go through an ethics approval process first. So it kind of negated our ability to do anything. And then we talked to the NHMRC and we discovered that actually, as long as all we're evaluating is exactly what we would be doing regardless, then we can get ethics approval after the fact. And it doesn't need to be from an HREC. It just needs to be independent review of ethics from somebody who understands all the standards and requirements. So an example of this would be a case review. So you have that one person, you talk about what you've done, you show the data, and you talk about why it works. And you do that in the basis of other existing research. Research itself is generally low or high. Negligible came out in January. It's actually changing something in the participant's environment to test the effects of what you're doing. The risks are increased above those existing in the service or program. It may not be a huge increase. It may just be a case of some additional inconvenience, but it's still an increase beyond what they were already receiving as part of their service or program, which is what changes it from being an evaluation to being a research project. You need to get additional consent, and that has to be done before you start the research. it's not covered in service consent. You have to have approval from an ethics committee. If it's low, it doesn't have to be an HREC. If it's high, it has to be an HREC. And the majority of what we do will be high given the populations that we work with. You have to have that approval before you can start recruiting participants to engage in that research. Your approval involves a full literature review, in-depth planning. There's a bunch of work that goes in. It takes some time. So it's different in a few different points, and you're welcome to check out the national standards and the Australian Research Code. That'll give you a bit more information. The national standards has a chapter 2 talks very specifically about the different risk levels, and there's a attachment that Amy will be sharing with everyone later, which is the evaluation guidelines, which is this one here. So they talk about quality assurance and evaluation is important to ensure effective work and the best outcomes, but confusion arrives over if the activity is research evaluation or quality assurance, and there may be similar research methods used. So this document is to assist organizations in developing a quality assurance policy and appropriate oversight. It's brief, so that helps, but it's quite useful just to get a better idea of what exactly it is that you're talking about when you're talking about evaluation and what you can get away with without having to do the full research pathway. So it covers appropriate oversight of quality assurance and evaluation. It has things on privacy, data collection, legislation, standards, and ethics review, and what's required if you do go through an ethics review. And yeah, so then I'm going to go into the evaluation framework, and I'm sorry if I'm speeding through this a little bit. I'm trying to make sure that we stay on time. All right, so a couple of different types of evaluation that I've put in here. One is a pilot program. So a pilot program, you're assessing something completely new that you've developed. You're applying an evidence-based practice that hasn't been used before in your area or sector, for example. So it may be, we recently were assisting someone with a grant where they were talking about a youth justice system that was used in Victoria, had never been used or hasn't been used to the same extent in Queensland, and they wanted to move that from one location, like take that same program and see if it worked in the same way or a similar way in Queensland. So in that case, it would be a pilot program. It's not something that's been done in Queensland. It has been done in Victoria, so there's some evidence there, but it's new here. So let's try, like, it's a pilot program. It can be client or staff focused. This one, I would consider this like research. So I would go through a research approval first before doing a pilot program. Generally, if you're doing a like global pilot program, changing up your whole service or program, you're changing up your whole staff HR system or whatever it is, it's something that you can probably do with enough timing and forethought that you could go through that whole ethics approval process. Now, if you have no interest in disseminating that, obviously you don't need to go through and get the research approval. But if you would like to be able to add to the evidence base to potentially publish or not so much for conference presentations, because you don't need ethics approval to do conference presentations. It may be a thing later on. I know some of the international conferences in the States that I've attended have started requiring some kind of proof of ethics for certain presentation types. You don't have to go through that process. But if you're doing a pilot program and you want to disseminate that in an academic article, a journal, for example, go for research approval first through an HREC, if it's a high risk. If you're simply evaluating a service or program you already use, or you're just expanding something that you've done, so for example, you have used this process in your service already in Brisbane, now you want to take it and use it on the Gold Coast in a different site or branch, you're just expanding what you're already doing, what you already have a fairly good understanding of. It's more of an evaluation now. Again, it can be client or staff focused. In this instance, I would call this more of a quality assurance assessment and something that you can get approval for after if you feel that you should be taking this to publish. All right, so key features of an evaluation. So you've got the consent. So as I mentioned before, consent can be embedded in your services agreement. It, all right, cat put up joys of animals. All right. It can be embedded in your service agreement or your staff contract. It's similar to the consents that you get provided at the doctors. And it's important to clarify that you're not talking about research. You're just asking for consent to use the data produced from their service or their program as part of an evaluation of that service or program. And it's always good to clarify that any information that's used will not be identifiable. So they cannot be identified from what you're doing. You can, like, there's nothing stopping you from going back to them after and saying, hey, by the way, what we did with you was really cool and I want to tell people about it. You won't be identifiable at all, and I already have your consent as it was in the consent form, but I just wanted to get you to give me an extra thumbs up, sort of thing. Data. Collect data. Objective is best. Subjective is also an option. So when I say objective, I mean, did the behavior occur? How many times did it occur? How long did it occur? Versus how happy do you feel? Are you more confident? Are you enjoying life more? Wherever it's possible, it's good to get integrity data. So is the service or program that you're talking about being done correctly? So the way that you write out that it's supposed to be done, is that what is happening? The reason for that, and this is something that comes more out of behavior analytic research, which is single subject research. You're just looking at one person and the change in that one person. In order to show that what you did is the cause of the change, a lot of those articles, they like to see that what you said you were doing was actually what was done, and how closely the people who were doing that stuck to what they said they were, like what you had told them to do. Another thing that you can be collecting data on is everyone collecting data on the same thing. Do they all understand it to mean the same thing? When I say happy, do you believe happy means the same thing as I do? And are we both collecting data on happy in the same way? So showing that, the data that you're getting are accurate because everyone understands the data to mean the same thing. Evidence-based. Keep a record of the articles that you use to guide the development of a service or program. It'll help you later. You'll need to have a literature review in whatever you publish or present. So having that kind of notation of what you actually use to get there is really good. And it also helps anyway, just to kind of get support. So when you're applying for NDIS funding for something in particular, being able to show articles that demonstrate that what you're talking about works can increase the likelihood of you getting the money that you're asking for. Doesn't guarantee it, but it can help. If you keep record of the relevant legislations and guidelines that relate to what you're doing, it makes it a lot easier for yourself. You've done this background work when you're developing what you're doing. By keeping a record of where you found the information, it helps you later if you decide, hey, that actually worked out really, really well. It's so much cooler than I expected it to be. I'd like to publish it. Now you don't have to go back and try and remember what you did and where you found it, because you already have the list. Ethics review. As I've said a few times, if you want to publish, then you need to include a letter in your submission that attests to the fact that the work you have done has been reviewed and has met ethical guidelines. You don't need to go to an HREC or Human Research Ethics Committee for a review of a quality assurance. However, you should have it done by someone who understands the national statement well enough to be able to properly assess whether or not it's quality assurance. And it should be done by someone who is independent of the group or even the organization that did that work. So our Human Research Ethics Committee, for example, there is a couple of people from our broader group of companies that is involved, that Logic is part of, but The only person on that committee right now who is directly a member of Logic is our managing director. Everyone else is external to our organization, and the majority, probably 2/3, if not more, are external to our group of companies to try and keep it as independent as we can. So that makes it a lot easier for us to do our own evaluation, but also makes it more open to everyone else outside of our organization and our group of companies. Conference presentations. Check out different options for conference presentations in your area, in the country. See what there is out there that your work might fit into. Check out their submission guidelines, their submission deadlines, and go for it. There's some really cool conferences out there that you can get involved in. You don't generally need to have ethics review. It's a good way to get in front of the sector. And depending on research interests, you'll find there are, academics and stuff at a lot of different conferences and things who may then go, hey, that was really cool. I want to do a research project and something similar. Would you be interested in partnering? And it gives you opportunities to take this stuff further with a group of people who have a lot more expertise and understanding of research than most of us who are working directly in the sector. Last piece, so journal articles. One of the easiest ways to figure out where to potentially publish your research or your evaluation, look at where you found the evidence to guide you. So which journals were publishing the articles that you used to develop this whole project? They're probably a good option for looking into actually publishing yours. So if it's along a similar line, they're more likely to pick it up. Each journal has their own niche, audience, their niche types of publications and things. Picking one that's similar to where you got your own evidence, there's a better chance that they will pick up what you're doing. You will need to go onto their website, find their submission guidelines, the types of submissions they take, see whether or not what you're doing actually matches that. So if they don't publish case reports, then you'll need to go somewhere else, for example, if that's what you're trying to publish. But that's a good way that you can kind of find out more about where you can publish. And the reason to publish in journals, it's more likely to get in front of academics. It will get in front of some people in the sector as well. There's quite a few people who will attend certain different journals and things. I mean, obviously, if that's where you found it, that's chances are there are other people looking there too. It gets it in front of people. It's now part of the evidence base, so that will help guide other people who are wanting to do something similar to what you've done. And they're just basically helps it become part of the track that other people go down in the future, and it starts to build, and hopefully it'll snowball. So the process, just check my timing. Yeah. All right. So first of all, embed your consent for evaluation in your service consent forms and staff contract. I say staff contract because it's probably the easiest place to have it for anything that you want to evaluate on an HR side of things. So if you've got a staff incentive program that you're establishing or that you've got in place already, or a well-being program that you use that you want to evaluate, you need to have consent from staff to be included in an evaluation. Best place to do that, staff contract. You can still have a standalone consent that you also use. It doesn't have to go into your contracts and things. That's also an option. It just has to be something on record from before you started the evaluation that shows that they consented to evaluations. Get your evidence base, and so your standard practices, and this is a key thing. Part of the major criteria is that the risk is no higher than your standard service or practice. So if your standard service or practice doesn't include using an evidence base, or isn't data driven, or doesn't include certain types of data collection that will strengthen your ability to actually publish or disseminate, look at whether or not you can make that part of your standard practice. If you can't, it's probably going to be a lot harder to do evaluation in this way, unless you're just using it for presentations. But if you can, I mean, it's going to improve your standard of practice anyway, because you're looking at more stringent measures, but it also means that what you're doing is not a higher risk. So if you're now collecting more data specifically for your evaluation than you would have been collecting in standard practice, that's a higher risk. More data, more observation can cause discomfort. It can cause, observer reactivity. It can cause other issues that would be classed as a risk higher than their standard service or program. So it needs to be embedded in standard practice in order for it to meet the criteria of being an evaluation. I love when I forget my own things. So ensuring regular data collection, objective measures, definitions, accuracy data collection, accuracy of practice. So I talked about those briefly earlier. Taking notes of your articles and things, using evidence-based to inspire and guide your practice. Graphing or doing a statistical analysis of your data, that doesn't affect your standard practice unless you're planning on users like showing the person their graphs in order to continue seeing improvements. So sometimes when you're doing a self-management strategy, you might graph their improvements so that they can see that things are improving, and then that might help them improve even further. If you're not doing that, then it doesn't have any effect on what you're doing. It just helps you to see whether or not you've got data that are cool and interesting and worth sharing. Get baseline information for comparison on a case-by-case level. Now, obviously, there are going to be situations where things are too crazy to be able to get a lot of baseline data, but when we bring in someone from a previous service into our service, generally we try, like particularly in our supportive independent living environments, we get some background information, including like the level of behaviors of concerns, like different types of behaviors of concern, types of restrictive practices, level of medications, things like that, as part of their history in order to help us establish what we're going to do with them. So that can be our baseline. We don't have to then be taking a bunch of data to say, like, without changing what's happening in order to go like, okay, well, we can kind of go, okay, well, this is their baseline from when before they started our service. So now we take data on what's happening in our service and we can compare the two levels. If you have an option for a group comparison, use it. So for example, if you've got multiple branches or multiple, staffing levels or something, and you're going to just trial your incentive strategy with staff in one branch because it's struggling in particular, like it's struggling more than others, for example, you can, get data on how that's working and compare it to the levels of the same behavior in another branch. And then maybe you'll decide later that you want to do it across everybody, but you can do that group comparison and get some of those group data. So you've got your control, the ones who haven't got the incentive program yet, and then you've got the guys in the incentive program that you're comparing them to. Of course, that only works if you're actually measuring the same change or behavior. Conduct a literature review. So after everything's said and done, when you've decided that you actually want to do something with this, you need to conduct a literature review. You need to then apply for your ethics review. And now I'm being very broad here as to what I'm calling a standard HRAC. That just means, so I've looked at a few different terms of reference, operating procedures and stuff for different organizations who have human research ethics committees, and this seems to be the general way of doing things versus what we're what we're doing or what we will be doing. So in what I'm classing as the standard, and this is by no means every single HREC, you'll email in your application. It goes through a gatekeeping process with the secretariat, who will check and make sure that everything that needs to be there in order for them to assess it is there. There are set meeting times throughout the year. They review multiple applications in every single meeting. So, for example, I'm part of Charles Sturt. We review about 12 every meeting, and they have 2 panels every month. Typically, evaluation reviews aren't done at those HRECs, or at least I haven't seen any reference to them. And they may include a subcommittee for low risk reviews. So they may have a smaller group of members that just do the low risk ones, because low risk research doesn't need to go through a full 8-person panel. And then you get notified via email or an online system of the outcome of your application. If you have any conditions, if you need to change anything, if you have to resubmit, like all the rest. In ours, we have built a research portal that you'll put the application through. So that meets certain security requirements and things to keep everything confidential and private. We have a gatekeeping process, including determining the type of the level of review required. So is it really an evaluation? Is it a low risk? Is it high risk? Each application is then assigned to a panel. The panel size is dictated by the type of review. So if it's a evaluation, I only need 2 people, low risk, maybe 3 people, whereas a high risk requires 8 members as outlined by the guidelines, the national statement. We then invite members to that panel based on the review type. The panel then reviews that submission, that application, and only that application. And then they notify the chairperson of the decision. The chairperson reviews it, signs off, and the researcher is notified of the decision via that same secure portal and receive an email notification to say, hey, there's some information in here for you to check out. So it's a slightly different process in that the idea is we only review one. Like when you make an application, it's generally about 2 weeks from application to when it actually gets assigned to a panel so that it's being reviewed as quickly as possible. It also means that members can pick and choose whether like based on their availability, whether they can take part in a particular panel, and it's not an intensive amount of preparation or reading involved right up to before you provide the before you're doing a meeting. So you're not having to lose a chunk of your time. Everything's done through a chat. Sometimes it's done through a video meeting. It's kind of determined by the panel themselves as to what they feel that they need to do. But it hopefully is a slightly more flexible system than some of the ones that I've read about. All right, so after ethics review, then you write up your evaluation and you publish it and or present it. All right, so that brings me to the questions point, and then I'm just going to put this up. This is my contact information. Feel free to contact me, and I will just this back up and stop sharing so that you guys can ask any questions that may be here.
Thank you so much, Megan. We don't have any comments in the chat, but if anyone wants to take themselves off mute, we've got some time left, which is nice. We're running on time today, which I always love. It doesn't often happen, but it's really good. Sticking
I'm
to
not
time.
sure if anyone else, sorry to interrupt, Amy, I'm not sure if anyone else has this issue as well, but I actually don't have the chat function. And I've heard other people say that at other meetings every now and then, but it just hasn't come up for me. So that might be the case for some other people as well.
I'm the same. Thanks for bringing that up, Kate. I thought it was just my computer.
Oh, I am apologize. I actually can't see that. So let me make note of that and try and fix that tech. That's
So
really
any of those
interesting.
links that you shared in the chat to begin with, some people might not have got either.
Okay, well, the links we'll share again in the post-event email. So the links, there's actually not too many. There's just Megan's contact details. Maybe if you want to put them back up on the screen, Megan, that would might help people. And okay, people are sharing the links just to share how to support people using the chat function. I think the Teams version that you have affects whether you can access the chat or not. Yeah, it's a good point. So there's a question from Philippa that's come up. So just wondering your thoughts on using grey literature for publications to enable more community sector organisations to read what others are doing. So journal articles are very expensive in terms of access, and obviously, like if you're not linked to a university, sorry, I'm adding my own comments on this now as well. So if you're not linked to a university, I mean, we have the same access issues as well. Like we're saying, you know, for staff that don't aren't linked to a university, then you know we share journal articles in ad hoc ways rather than actual proper access. So yeah, keen to hear your thoughts on that, Megan.
Yeah, I mean, honestly, it depends a lot on who you want to get in front of. But there's no like, sector magazines and things. There's no reason not to also be trying to chuck those in there, or creating blogs and things. There's quite a good chance that, and I can't speak for academics because I'm not one, but it's quite possible that they're also having a look at some of those things to get some ideas of some cool stuff that might be going on. In terms of getting things out there, sometimes you'll have staff who might be in uni that you can, like, there are occasions where that's what we do, is we'll go like, oh, by the way, if anyone's in a program or whatever and has access to articles, I've done a Google search and this sounds really good or really useful. Does anyone have access that they could potentially share this with me? That's helped us a few times. So I've had a few staff doing that a little bit for each other, and that's been one way that we've been able to access journal articles. Like, I know what you mean. I tried a couple of years ago, joined the American Psychological Association so that I could get into PsycInfo. It cost like $500 to get into PsycInfo and have access to that database, because that's what I used during my studies. And then it's like, oh, by the way, every single article that you want access is like $40 on top of that per article. But I mean, ultimately, if you're just like, if what you really want to do is just get this in front of the sector in order to help each other, there's no reason that you can't do that by using some of that evidence and by using, that as a pathway to get your information out as well. Be aware that it's possible that if you try to then publish what you're doing in an academic article, if you don't have any academic articles behind it, that you won't be able to, that they may decide that it doesn't have a strong enough evidence base to publish. But at the same time, you can always use the gray stuff to sort of develop what you're doing. And then if you decide, hey, this is actually really good and I really want to try and get this out there on a broader sense into an academic journal or something, to try that pathway of going, okay, well, now I'm going to do like a Google Scholar search and see what actual academic articles are out there that I can either get that aren't going to cost too much, or that I can get through someone in my job or in my personal life who actually has access to that by being enrolled in university. Like, it doesn't have to be something that you do necessarily beforehand, but it could be something that you do after, so that then you can strengthen your evidence base to publish academically, like in a an academic or scientific journal.
We also had Laura, comment saying if you come across a journal article that you want to read but can't access, you can usually email the corresponding author, and they're usually very happy to send you a copy. I've done it a couple times that way too.
Yeah.
I thought I saw Candace. I'm not sure if she's still online. I thought she had her hand up, but maybe can't unmute herself.
No, Amy, that was just to agree with what everyone was saying in
Oh.
terms of not being able to access the chat function.
Oh, okay.
Sorry.
Okay, I'm so sorry. Well, there's
That's
not too
okay.
many things going on in the chat anyway, so rest assured you're not missing out on too much. I'm so sorry, everyone. We'll definitely share some details around chat. But this, yeah, first time that's happened to us, so sincere apologies. Did anyone we probably have time for one more question before Megan has to run off. I'll just double check the chat again and see if there's another question. Are we going to get the information sent to us? Are you happy to share the presentation and the recording, Megan?
Yeah.
Yep.
So I'll send you, Amy, the PDF of the slides Monday when I find the other stuff that I was planning on sending you to share with everyone. I did
Great.
want to mention next week on LinkedIn, we'll be sharing we're looking for a research and development lead. So I'll be sharing the job ad on there. So I would greatly appreciate it if people would share that with their networks. Check out our LinkedIn and share that with their networks, so we can hopefully find someone really cool to help us do further in this space. But
sounds great. Good luck. Oh, there is one other, I guess, question. Do you find that there is a trade-off between making publishing a goal and conducting an evaluation where participants share more openly? due to not fearing being exposed?
In all honesty, because the consent is part of the service agreement anyway, I don't think that it tends to be in the forefront of their mind when they're doing stuff. And publicly, the goal of publishing, it's not something that we have in the forefront. So everything we're doing is not for the purpose of publication. It's more a case of we're trying to set up the structure so that if something we do seems like something that we really should share because it's gone beyond what we see everyone else doing, or it's something that, we had, for example, a client who has visual impairments, is legally blind, and extreme reactivity every single time there is a fire drill. It's extremely hard and extremely dangerous to get them out in a fire drill. And when they're an adult and everything, when we looked at the research to find out how we can actually help this person and make them safe and make their staff safe, there was nothing. So at that time, we didn't have any structures in place in order to allow us to go forward and actually potentially publish the work we did. But we cannot be the only people who are dealing with something like that. And because we didn't have the structures in place to allow us to then take that information and share it, we couldn't. And that's sort of more what this is about. It's about setting yourself up to be able to share if something happens that's worth sharing and of benefit to share, but it's not with the goal to share.
Yeah. Interesting. Very interesting. We learned so much today. I just have on the screen as well the flyer that you sent me around the ethics committee membership, if you wanted to speak to that before we close.
Yeah, so as I mentioned, we're trying to do things a little bit differently. Our ethics committee is completely open to the entire sector. So if you're doing an evaluation or research and you need an ethics committee to review it, you'll be able to submit to us. As I said, most of our members are not part of Logic Institute or Community Services Group, which is the group of companies we're a part of. It's external. So we'd love, we're trying to create a big group of members and things who can take part in different panels. If it sounds like something that would interest you, hopefully it's not a huge time constraint for people to be part of this in the way that we've got it set up. That's kind of why we've set it up the way we have. Please reach out if you'd like to learn more, contact me. If you'd like to take part, we'll be sending this out as well when we send everything else, but it would be really cool to get people involved. So yeah.
Thank you so much, Megan. I think that's a really good way to end. So I've got a couple more slides, but I am aware that you need to jump off at 11. So I just wanted to say we really appreciate your enthusiasm to share with the network and coming back a second time, which means we didn't do too badly the first time. So yeah, really lovely to have you here, and we'll follow up with any further questions after the webinar with you as well. So if everyone's happy to stick online, there's just a couple of extra slides and upcoming events that we're going to go through. So I'll just share these for those that can access the chat. I'll share these in the chat with you now. And then just talk through the slides for a minute. So I'll be presenting a webinar to community organisations on the 7th of March on using data to support grant writing applications. And this webinar is for organisations who are applying for the Skilling Queenslanders for Work funding. However, it's open to anyone to attend. So it's not specifically a Research Evaluation Network webinar, but we will look at how to find quality information, navigate freely available and open data sources, and then integrating them into a grant writing application. We also have a webinar coming up. So March is really busy. We've got one on Thursday, the 14th of March at 9:30 a.m, where we'll be discussing effective survey design and methods. There's also at the end of March on the 25th, we have an upcoming presentation from YFS on key learnings on outcome measurement from the sector, and YFS will speak to their outcomes measurement journey, including key considerations, challenges, and enablers along the way. So lastly, this I thought I'd share with you the draft plan for the network in the coming months. So we have an upcoming session planned on amplifying co-design and lived experience leadership in evaluation. Um, at Six Brisbane's data team will be joining us to talk about their data science journey and wellbeing, measuring wellbeing, and also have a webinar on data privacy and capturing consent later in the year. And a couple of these webinars, you may notice that my colleague Stacey DeKama is facilitating. So Stacey coordinates our quality collaboration network for the sector. And that's a network interested in some of the same topics that we are for this year. So the webinars this year will be led or facilitated by Stacey, and then others will be facilitated by myself. And so, yeah, really looking forward to those sessions. Later on in the year, we'll also be hosting a webinar on capturing the voice of children and young people, and a webinar on trauma-informed evaluation. And we're also finalising some guest speakers for topics and exploring opportunities for webinars on culturally safe evaluation methodologies and Indigenous data governance and data sovereignty, developmental evaluation in emergent, rapidly changing and complex settings, and also looking at hosting some more sessions on data visualization, data storytelling, and communicating impact. So lots of really exciting events on the horizon for the network this year. There's also the Data Catalyst Network. So I'm not sure if many of you are connected with that network. It's a national network run by and supported by the Info Exchange and the Paul Ramsay Foundation. Again, specifically for the not-for-profit sector, but it's national. And so they've got a upcoming webinar on Wednesday, the 20th of March, and that will be on First Nations data sovereignty. So you can contact Kristen Moller-Saxon if you're interested in connecting with that network too, or for more information, I'll send the details in the chat for those that can access, but also just reach out to me if you need their contact details as well. So just share that in the chat now. And then that's all that we have for today. So thank you for staying online and engaging with our discussion today. And thank you for, being a Friday. It's lovely to still have people engaged. So we just launched some quick polls for this webinar that will pull up on the screen now. If you're able to do that for me, Michael, thank you so much. So yeah, I hope everyone has a wonderful weekend. Thanks. I think Megan's left now, but thank you again to Megan for joining us, and look forward to connecting with everyone again at our next webinar.